afternoon, and greetings from Human Biological Institute. Welcome to another yet engaging session of our scientific forum, We Talk, Do You? At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one of its kind platform, that is Puberty to Menopause. These sessions feature leading experts from across the country who share their valuable insights on health topic aimed to raise awareness and promote overall well-being of the society at large. Today, we are delighted to have Dr. Krishna with us to share her expertise perspective on the topic of understanding menopause, symptoms, stages, and myths. I shall be sharing more about today's speaker in a short while. For a moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited. IIL was established in 1982 by the National Dairy Development Board as one of its unit and was later incorporated as company in 1999. HBI was founded in 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. Our first manufacturing facility was set up in Ooty. This facility is one of its kind in India, rolled out the country's first varicose culture rabies vaccine in year 2000. Today we are leader in ARV, that is anti-rabies vaccine segment, with presence around 60 countries. HBI has launched several other vaccines and become a major player in human vaccine segment. HBI has been a keen supplier of pentavalent vaccine to the government of India under its universal immunization program. Yet another milestone. HBI introduced Havishare in 2024, India's first indigenous hepatitis A vaccine aimed at providing protection for both children and adults. Our vision of shaping global healthcare by spearheading the One Health initiative and the mission to innovate, produce, market quality healthcare products and service to improve the extend lives. We are committed to providing affordable, high quality products through continuous technical innovations to meet our customer needs. As a market leader, we have taken significant steps towards reducing plastic burden by 160 tons per annum through the introduction of eco-friendly packaging for our flagship brand, that is Abhirap. As a part of corporate social responsibility, that is CSR initiative, we have adopted schools where IIL produces infrastructure, support, and basic facility, including assistance with the midday meal program in association with NDDB. Through the gift meal program, hundreds of school-going children benefit from daily milk nutrition. We have also donated oxygen generation plant to the Langana Institute of Medical Sciences and Research, commonly known as TIMS, TIMS. These are few highlights about IAL. For more information, please visit our website, that is www.indyimmune.com. Puberty to Menopause is one of its unique initiative where we address a wide range of topics related to women's health and well-being. Welcome to today's episode We Talk Do You. This session is dedicated to highly significant and often overlooked topic which is understanding menopause, symptom, stages and myths. To help us better understand this condition and its impact, we are joined today by Dr. Krishna Mukherjee. We would like to begin the live talk with a short welcome video that introduces our guest speaker and shares a brief overview of her expertise. are honored to welcome Dr. Krishna Mukherjee, a distinguished medical professional with a strong background in obstetric and gynecology. Dr. Krishna holds her MBBS degree and has further specialized with the MS. She is currently practicing in Rameswara Nursing Home, Kolkata, West Bengal. With her deep expertise and her commitment to patient care, Dr. Krishna brings a valuable insight into women's health with a rich experience of 30 years. We are delighted to have her join us for today's P2M Live Talk. Welcome, Doctor, for our P2M Live Talk.
Thank you, dear.
Most welcome, ma'am. So, ma'am, we would like to begin the live talk with some questions we have prepared. And let's begin today's session with the commonly asked question on the topic, which
Sure.
is understanding menopause, symptoms, stages, and myths.
Okay.
So, my first question to you, ma'am, what is menopause and what exactly happens when a woman's body during menopause from a medical perspective?
You see, dear, at the age of 40 to 45, the woman may miss her period. But if it is missed for a whole year, that is 12 months, then it is called menopause. And during menopause, there not only the period is being missed, but she lost her fertility. She may lose her temper quite frequently. She may lose her hairs and nails, may develop pelvic and lower abdominal pain. Frequency of micturition is also a noted feature. Along with that, she may be irritable. She may be, you see, in a depression that she could be a mom again. These are some short things about this menopause symptoms. But as a medical person, I can tell you that this is nothing but loss of stoppage of the production of estrogen and progesterone hormone. But you see, dear, this is the very common thing in life cycle. So we can use some different tactics to avoid all these things that people can do the older old age symptoms and all this. Okay,
Yes, ma'am. Thank you so much, ma'am, for giving the answer in such a way that it is being understood by a layman person and also with the medical perspective. Thank you so much, ma'am, for this wonderful answer of
welcome.
yours. My next question to you is: at what age should women expect to start noticing premenopausal changes?
In our country, we are tropical people. In our country, it may start from 40, and in the Europe, where the temperature is less, it may start from 45 to 50.
Okay, okay, ma'am. So, ideally, it's in between 40 to 50.
Right.
Okay, thank you so much, ma'am. My next question to you is: are there any early warning signs women often overlook or that indicate menopause is approaching?
Yes, my you near 38 to 40, she may have a bit loss of periods within 1 or 2 months, or she may have it after 2 to 3 months. These are quite natural. Along with that, I told you about the mood swing, hot flash, suddenly
Yes,
rising of heartbeat. Huh? These are also
yes.
symptoms of menopause, along with pelvic pain, joint pain. These are the symptoms of premenstrual,
Okay,
sorry, premenopause.
okay, ma'am. So, ma'am, are these pains and this fluctuations in the mood and everything happens with some hormonal disturbance?
Obviously, these are hormonal disturbance, absolute.
So it affects your mood and it also causes pain.
Yes.
Okay. So, ma'am, my next question is you to you is how we can clinically differentiate between the perimenopause, menopause, and postmenopause.
You see there, if we go for blood test, the level of E2 and P4
Yes.
along with this, sometimes AMH, there might be some lower level of the hormones, and so we can decide it is premenopause or it is absolute menopause.
Mm-hmm. Okay, ma'am. Thank you so much. So, ma'am, is it necessary to get hormone level testing to confirm the stage of menopause, or it can be diagnosed based on symptoms alone?
You can diagnose it alone with the symptom also, as because these are the a bit costly test, na? So
Yes, yes.
we can also depend on the symptoms, dear.
Okay, ma'am. So, ma'am, as you have mentioned that it's costly test, so what is the initiation price of this test if someone wants to do it?
It may be a three-digit one.
Okay. Okay, ma'am. Thank you for this answer. And my next question to you is, ma'am, how long does each stage typically last, and what factors influence that timeline?
I told you before, dear, from 40 to 50. It may last or it may be completed before that. And
Yes.
and I told you about the symptoms of perimenopause. And
Yes.
if anybody loses her mens for 12
Mhm.
long months, then it is
Okay.
absolutely menopause.
Okay. Okay, ma'am. So, ma'am, if the hot flashes and night sweats are often discussed, but what are some
Mm.
uncommon symptoms of menopause you think more women should be aware of?
They may lose their memory,
Okay.
huh? And
Yes.
they may lose their memory. They may be in depression. Huh?
Mhm.
So
Mhm.
these are also they should take care of.
Okay, ma'am. So, ma'am, if some patient come to you and you are aware that they are going with the depression, how their families or how their colleagues, friends should console them during that phase of them? Like, what are some factors we can keep in mind for our mothers or maybe our relatives who are going with that phase?
You see, I will ask their families and friends to give them the company to
Yes.
talk with them about this thing, this menopause thing. They
Mm-hmm.
should take care of their diet, their activities, and they should take part social and familial activities in a bit expanded way. And
Yes.
sometimes I will ask them to leave along with your bags and friends.
Yes.
No, it is not always possible. And
Yes.
obviously, I will ask them to give the next generation
Yes.
their, and educate them about their duties. Don't take
Yes.
all the loads on you, dear. You need your time, and this
Yes.
and psychological management is also necessary. As because
Okay.
inevitable.
Okay. Thank you so much, ma'am, for explaining all this thing so in so much detail. And this wonderful answer of yours reminds me that how we can console our family members who are going through that phase and our mothers or maybe relatives. So we can do that. We can keep this point in mind, and I'm sure our viewers might be, listening to you, and they can also think on these factors which you have mentioned right now. Thank you so much, ma'am. So my
Yes.
next question to you is, yes, ma'am. So my next question to you is, are there any treatment options available to tackle the symptoms?
You see, dear, sometimes there is a mineral loss in our body during this period.
Yes,
We should we
yes,
should keep an eye on that. We can
yes,
give them the therapy with vitamins and minerals, along with psychotherapy is sometimes very very and we should the track of their diet. Sometimes we may give
yes.
them estrogen if it is very
Okay,
necessary.
okay.
In
So,
surgical,
ma'am, just
say
now you mentioned.
just take the surgical menopause where the estrogen
Okay.
level is blocked by us. So in that case, we should give boosting.
So, ma'am, right now you just mentioned about the psychotherapy. So, what does it really means in terms of the therapy you just now mentioned?
Allow somebody to take care of your mind. You can rely on them with your eyes closed and talk with them. If you have got
Yes,
headache, take the medication. And if you have
yes,
got the thought of that I'm segregated, just leave it.
yes,
But if it is more, you cannot handle it, then please take medication.
correct. Thank you for that answer, ma'am. I'm sure my viewers must be having a note of it. So, my next question to you is, what role does diet, exercise, or sleep play in managing the menopausal factors or symptoms?
Diet is a very important one as because mamas are always keep their nutrition away before the family. So diet is very important. Exercise
Yes,
is the proper way to take the oxygen inside so that you can avoid your more the depression and your pain also. And
yes,
you talk about sleep. Sleep is also necessary to take care of your mental health.
correct. Yes, ma'am. So, ma'am, it reminds me of another question that, like, if someone is depressed, we usually say that that person sleeps more. Or in is it the thing that in menopausal symptoms they sleep more as well for the women, or more sleep is required for them?
No, no, 8 hours is enough.
Okay. Okay, ma'am. Thank you. So my next question to you is, what screening or preventive care should most postmenopausal women should prioritize?
Please concentrate on your diet, your
Yes,
regular activities, exercise, socialization, and as I told you before, please leave the house in with your friends and baggage for a while and allow the next generation to take care of themselves.
yes. You're reminding me that yes, every woman should empower themselves in such a way that they don't require another person to rely on. So they should be on their own.
Mostly.
Yes, ma'am. Thank you for this answer, ma'am. The next, yes, ma'am, you're saying something.
No, no.
Okay. So, ma'am, is weight gain during menopausal is inevitable, or can it be managed with the lifestyle choices?
You can manage it with your lifestyle choice.
Yes. So, ma'am, is it usually seen that weight gain is most common for the menopausal women?
Mostly, dear. As
Okay.
because thyroid hormone is also get depressed at this age, so it is
Okay.
mostly common.
Okay, okay. So, what advice would you give to women who feel embarrassed or uncomfortable talking about this menopause and with their friends or doctors? So, what advice, according to you, should be given to them?
You see, dear, doctors are also friends. So you can tell someone to be relaxed. So you
Yes.
can get some practical way to relieve from this symptom.
Okay, ma'am. So, what are some ways, if you can elaborate more on this, ma'am?
So I told you as before,
Yes,
concentrate on yourself
yes,
a little bit more than your family.
correct. Okay, ma'am. So, ma'am, what is the biggest myth or misconception about menopause that you wish more people should understand?
The biggest myth is that I am of no use as because I become infertile. That is absolutely a misconception. You have
Correct.
done your duty in your time. So it's
Yes,
your time to be retired and to be pampered.
true. Wow. You have made a very strong point, ma'am, that if the women if the women go through that depression or postmenopausal symptoms, they feel that they are of no use. So that this is not correct. So you have made a very strong point, ma'am. Completely agree with you on this. Thank you so much for putting your point on this. Thank you. So my next question to you is there a menopause care plan that women can follow or something proactive instead of reacting to any symptoms?
Yeah, you should join in any group. Ah, so
Yes,
with whom you can do some social activities, or
yes,
if you don't have time to do all these things, you can concentrate on reading or
yes,
whatever you have uh, wishing to do from your young ages. Concentrate on that. Live for
yes,
yourself.
yes. So, ma'am, what are your three takeaways message of today's live session, which you would like to tell to our audiences and viewers and women who are going with that phase, who are facing this battle silently, who are, in a situation that they cannot discuss it. So, what is your key message to them, ma'am?
Accept it as because it's the eternal truth.
Yes,
Make a very good friend with whom you can share everything, or your doctor. You can also take him or her at your confidence. And
yes,
number three, the life is big, dear. It is not ending here. You have done your part, and now a new era is opening to you. So concentrate on your diet, exercise, socialization, and your movement.
great, ma'am. Great. I'm sure if your patients might be watching this, they must be feeling very glad that you are their doctor. So, thank you
Thank
so
you.
much for putting this point again and reminding our audiences to make more friends, to involve in social gatherings, and you know continue with their hobbies. That is very much required to de-stress them from their day-to-day life. So thank you so much, ma'am, for this very vital points which you have mentioned, and I'm sure this will help our audiences and viewers in future and maybe in present also. So thank you so much, ma'am. We are towards the end of the session, and while concluding the program, thank you all for being part of We Talk Do You. We hope today's session was informative and valuable in spreading awareness, which is understanding menopause. A special thanks to Dr. Krishna Mukherjee, for sharing her time, expertise, and insights with us today. For those who would like to revisit the program, the video will be available on our social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word as many, including your friends, families, and relatives, as Doctor just now mentioned. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself. So, thank you so much, ma'am, for joining us
Thank
today
you,
for
dear.
this lecture. Thank you. Uh, I can't see any questions in the chat box, ma'am. Uh, no questions for today, ma'am. Thank you so